I'm Dr. Kimberly Spence, a neonatologist. We want to congratulate you because if you're watching this, either you or someone you care about is expecting a baby. Taking care of yourself and your baby is a team effort. You'll meet lots of people during your pregnancy and postpartum period, including pediatricians, obstetricians, nurses, occupational therapists, lactation consultants, and social workers. This is an exciting time, but can also be scary. You probably have a lot of questions about how things will go for you and your baby after delivery.
I'm Becky Bodeker. I'm a mother-baby nurse and a lactation consultant with SSM Health. You've already taken the most important step for you and your baby, and that is getting prenatal care. It's important that you continue to come to your appointments regularly and that you take your medication just as your doctor prescribes for you. Both of these things will help you provide a safe pregnancy for you and your baby. You are the most important person in your baby's life right from the start. Babies who've been exposed to opioids frequently develop symptoms of withdrawal after birth. This is called neonatal abstinence syndrome, or NAS for short. The good news is you are what your baby needs during this time. During this acute withdrawal period, your baby will need to stay in the hospital for at least 4 to 7 days. And since you're the treatment for your baby, you need to stay too.
I am Mary Hope, an outreach educator with SSM Health. Some symptoms your baby may have during these first days could include tremors or trembling, fussiness, high-pitched crying, sleep problems, tight muscle tone, stuffy nose and sneezing, poor feeding and suck, the need to suck a lot, diarrhea and sweating. But again, you are what your baby needs during this time. Usually, these symptoms can be managed by using simple comfort measures. The first step is to keep you and your baby together. Even after you are discharged by your doctor, you will be provided with a room to continue rooming in with your baby. There are lots of other things you can do to soothe your baby during this time. You will want to decrease stimulation. We recommend limiting the number of visitors, keeping the lights dim and the sounds low. Don't disturb your baby if sleeping. Simply holding your baby may be enough for your baby to avoid needing to go to the newborn intensive care unit or NICU. Specifically, holding your baby skin to skin or swaddling in a light blanket while gently rocking can soothe even some of the most agitated babies. We also recommend feeding your baby on demand. Short or small frequent feedings are going to be best for your baby. And offer a pacifier. This can help with your baby's need to suck and will also help with consoling. Caring for a newborn baby is tiring, and caring for a baby that may have increased comforting needs may be even more tiring than normal. For that reason, we encourage you to ask for help when you need it and to think about who you can ask to come help at the hospital and when you are at home.
Breastfeeding is one of the most important care decisions you can make for your baby. Please know that if you are taking methadone or Subutex, there will not be enough of those medications in your milk to have any effect on your baby. There's not enough in your milk to treat the symptoms or to keep your baby dependent. Breastfeeding is in fact very safe and good for you and your baby as long as you don't have other serious illnesses. You may notice when you nurse your baby that you feel relaxed, calm, and less anxious. That's just one of the many benefits of breastfeeding. Your body makes these feel-good hormones when you make milk. Breastfeeding may even lower your risk for postpartum depression. It also makes the bond with your baby even stronger and makes you want to protect your baby even more. All of this leads to a better home life for you and your baby. Breastfeeding has lots of benefits for your baby too. For baby, breast milk is the perfect food made just for him or her. Your milk is easier on your baby's tummy than formula. In the first days, your milk is just the right volume, and it's soothing to your baby's stomach. He can suck a lot without overfeeding. Babies who get their mom's milk usually spend less time in the hospital and need to take less medicine than those who don't. Your milk gives your baby benefits for life. It helps build a strong immune system and can lead to less ear infections, colds, and other more serious illnesses. It also helps with brain development. When you continue your treatment, Go to as many of your prenatal appointments as possible, have no relapses in the month or two before delivery, and have a negative urine drug screen at the time of delivery. You may be able to breastfeed or provide milk for your baby. Throughout your prenatal care, keep talking to your doctors and nurses about breastfeeding, and be sure to ask any questions you may have.
We want your baby to be able to do the things that all babies do. When your baby is feeding well, sleeping for at least an hour at a time, and able to be consoled within 10 minutes, then things are going well. If any of these things are not happening, the nurses and doctors will work together with you to come up with a plan to make things better for your baby. In these first few days, you will become the expert in caring for your baby, along with the hospital staff there to support and assist you. If your baby needs more help, we can give a single small dose of morphine and continue watching your baby. If he needs several doses, then he will need to be transferred to our NICU. Our NICU has private rooms, so you will be able to continue rooming in and caring for your baby. Another issue we will focus on is making sure your baby is gaining weight. We mentioned earlier focusing on short, frequent feedings. We also want to add extra calories when we can. So if your baby takes formula, we will be using 24-calorie formula rather than the standard 19 calories per ounce. If you are breastfeeding and your baby needs extra calories, we can help you pump and fortify your milk. Once your baby goes home, she will still have some of these symptoms and will continue to need special attention. Your baby is also at risk for some longer-term complications. Good follow-up care will ensure that your baby is developing normally. It's important to stay involved with the program and get the services your family needs. You should identify a pediatrician now and fill them in on your history and your baby's needs. If you need help with this, we can suggest some pediatricians. You will need to make the first appointment before you and your baby leave the hospital. Keep regularly scheduled appointments and be sure to reschedule if you miss one.
In summary, keep taking prescribed medications and coming to all your prenatal appointments. Once your baby is born, you are the treatment. Plan to stay with your baby until discharge. Breastfeed if you are able. Neonatal abstinence syndrome does not end at discharge. Following up with your pediatrician and other appointments are essential for your baby's continuing good health. We can't wait to welcome you and help give your baby the best start possible.